Echo is an incredible tool to use, and it aligns with the goals and objectives of Nurture New Jersey, as well as the goals of the New Jersey Department of Health. I think that it is a critical component to the bigger picture of many other initiatives that are happening.
We work together and we work hard at the beginning in terms of crafting and curating the topics that are focused on the issues that are top of mind in New Jersey.
The topics that ECHO deal with are real and relevant, and they are given time. They're given not just evidence, but case examples and real life circumstances in a non-punitive way.
So we have this wonderful didactic presentation and a case study, and I find that even as a facilitator, I'm learning so much when we are covering things like weight bias in healthcare, or we're covering hemorrhages and the risk of hemorrhages.
Keeping these issues at the forefront, having a diverse conversation about, a diverse but specific conversation about what's happening in New Jersey, and learning from colleagues.
To see practitioners saying, hey, I haven't been doing that in my practice, but I'd like to do that. This sounds like something that will really work well for my organization. Or, how can I do this for my facility, my organizations? I want to provide the best care to my patients.
She submitted the case, and I think it took a lot of courage and a lot of humility to say this was a really challenging case. I felt like I didn't necessarily handle it the best way. I'm looking for feedback about how people think that, moving forward, we could handle these kinds of cases better. And people had really constructive feedback for her, and she came to subsequent sessions. So an opportunity, and that is exactly what ECHO is made for people who are looking for really concrete feedback on challenging situations, whether they are social or clinical or a mix of all of it.
Whether it's a new idea on how to care for a client, or a new idea how to care for yourself, or how to interact in the community, you always walk away with something.
Always the updates on substance use disorder in pregnancy is very, very relevant.
Terms that I thought would be acceptable and respectful that perhaps could have been better. And so we saw that from our learners, and they were fairly open to sharing in the chat, I was using this terminology and I thought it was okay, but now I know that it's not. And so in the future, I'm going to adjust that to make sure that, I'm treating my clients and patients with respect and dignity.
I was really happy to see midwifery as a piece of this, because we've been working so hard for so many years to have midwifery acknowledged as an important piece of maternal health and as important healthcare providers.
There was a session on linguistics and how to use the language line.
It kind of gave me a little more confidence to pull out the translator, even if it's on my phone, and familiarize myself with it, as opposed to I'm one of those ones that a lot say, I don't speak Creole. So how can we help, the Haitian population if I don't speak Creole?
And the wonderful thing about ECHO, it gave us an opportunity as, time progressed to say, hey, it would be great if we expanded on this particular group, or let's take a look at this population. And then I saw those things come to fruition. They were topics that we were going to be talking about.
That's really foundational, that you come to learn details about a specific topic that you might not otherwise have access to information about. But I also think just hearing other people's perspectives that you might not be exposed to otherwise. And then the humility that people have in bringing the cases. People bring cases that are really challenging.
You can go online and sign up for courses that tell you, how to deal with sepsis from a clinical viewpoint. But getting more information about how these issues affect people and affect people's lives and affect the lives of families and communities, and how all of that intersects to have an effect on health is, I think, the value that it brings. So more of that.